So if you've ever had a really bad muscle pull, in your back or your neck, chances are you've heard of cyclobenzaprine. It's one of the top prescribed drugs out there for muscle spasms. Everyone calls it a muscle relaxant, but what if I told you that's not really what it is at all?
Right? It's a fair question. You'd think a muscle relaxant would go right to that tight, knotted up muscle and just tell it to relax. So the big question we're going to unpack here is this. How does this stuff actually get the job done?
And boom, there's the big reveal, right at the start. It doesn't really touch your muscles directly. Nope. It works on your central nervous system. We're talking about your brain. And, that one little fact completely changes how we need to think about this drug, from what it's good for to what the real risks are. So, here's the plan. First, we're going to dig into why it's such an unexpected kind of relaxant. Then, we'll get into the science of how it actually works. After that, we're on to the really important practical stuff, the rules for using it, the side effects to watch out for, and finally, we'll pull it all together for the big picture. Okay, let's kick things off with our first section, an unexpected relaxant. It's time to really understand what this medication is and what it isn't. Let's just look at the official definition for a second, because the key words here tell the whole story. See that? Centrally acting, that means it works on the brain. Add-on therapy, that means it's not a magic bullet, it's meant to be part of a team with rest and physical therapy. And maybe the most important part, it manages the symptom, the spasm, but it does not fix the injury that's causing it. And this slide lays out the difference perfectly. On the left, you've got your typical idea of a muscle relaxant, something that works right on the muscle tissue. But cyclobenzaprine, over on the right, is playing a totally different game. It works way upstream, at the command center, your brainstem, and basically tells it to turn down the volume on the signals that are making the muscle spasm in the first place. So, now that we know where it's working, let's jump into section 2 and figure out how it's working. We're going to take a little peek inside that command center. Okay, now this is where it gets really fascinating. The biggest clue to how cyclobenzaprine works, and also why it has the side effects it does, is its family tree. Chemically, it's almost a carbon copy of an older class of drugs called tricyclic antidepressants, or TCAs. That family resemblance is everything. It's the key to understanding how it affects your brain. So let's just walk through the process. It's pretty simple, really. First, you get hurt, and your body, trying to protect itself, causes a muscle to spasm up. Step 2, your brainstem kind of panics and goes into overdrive, sending out all these frantic signals that keep that muscle locked up and painful. That's where cyclobenzaprine comes in. It goes to the brainstem and just quiets things down. It turns down the volume on those frantic signals. Once the alarm bells stop ringing, the muscle can finally let go. All right, so if this stuff is powerful enough to work on your brain, it makes sense that there are some pretty strict rules for using it. And that brings us right to section 3, the rules of use. This is all about how to get the benefit without running into trouble. So what's the official playbook, according to the FDA? Well, its job is very specific. It's an add-on for acute problems, like a sudden injury, not for long-term chronic pain. It's supposed to be used with rest and physical therapy. And again, you see it right there. It is not, on its own, a cure. Now, listen up, because if you only remember one thing from this section, please make it this. Cyclobenzaprine is a short-term solution. That's it. We're talking 2 to 3 weeks maximum. And why is that? Well, frankly, there's just no good evidence that it helps for any longer than that, and the longer you take it, the more the risks can start to pile up. Now, you might hear about it being used for other things off-label. Because it has that sedative effect, and because it's so similar to antidepressants, sometimes doctors use it to help with sleep in fibromyalgia, or for things like tension headaches or TMJ. Just remember, these are not its official FDA-approved jobs. And talking about its different effects brings us straight to our next section. And it's a really critical one, risks and side effects. Because this drug works on your brain, we've got to read the fine print. No big surprise here. The side effects are mostly neurological. And look at that chart. Drowsiness is the heavyweight champ, affecting up to half of all people who take it. That's why they tell you not to drive. Dry mouth is another big one, followed by dizziness, and just feeling wiped out. These aren't random. They are direct results of how it's working in your brain. Okay, beyond those common issues, there are some more serious risks, even if they are less common. It can speed up your heart rate. It can cause confusion and even hallucinations, especially in older adults. And then there's something called serotonin syndrome. This is a really dangerous condition where you get way too much of a brain chemical called serotonin, and it can happen if you mix this drug with certain other medications.
Which brings us to what might be the single most important slide here: drug interactions. Let's be really clear. You mix this with anything else that slows down your brain, like alcohol, opioids, or benzos, and you're risking profound sedation, coma, or even death. Mix it with a lot of common antidepressants, and you risk that serotonin syndrome we just talked about. And that last row, that is a non-negotiable. It should never, ever be taken with a class of drugs called MAO inhibitors. That combination can be fatal. Full stop.
Whew, okay. We've talked about how it works, the rules, the risks. So for our last section, let's just zoom out and put all the pieces together to see the big picture.
So who needs to be extra careful here? Well, the elderly, because the risk of confusion and falls is much higher. Anyone with liver problems, since the drug can build up to dangerous levels. And it's a hard no for people with a history of certain heart conditions. For pregnancy and breastfeeding, it's one of those only if you absolutely have to situations after a long talk with a doctor.
You know, this quote just says it all. It hits the nail on the head. Cyclobenzaprine is not the entire solution. It's one tool, one piece of a much larger plan that has to include rest, physical therapy, and actually figuring out why you're in pain to begin with. So, at the end of the day, here's the deal. Cyclobenzaprine is a really powerful tool. It can bring serious relief for those awful acute muscle spasms by calming down your central nervous system. But that power comes with a price, a trade-off of very real side effects and risks. So that leaves us with the final, most important question, the one you have to discuss with your doctor. Is that trade-off worth it for you?